Hello, my name's Craig Anderson, and it's a great pleasure to present the results of our work on the ENCHANTED trial entitled The Effects of Intensive Blood Pressure Lowering on Cerebral Ischemia. I'm presenting this on behalf of a large investigator group, in particular Dr. Chen Chen and Minglu Wurang, who are unable to attend today. We know that early treatment with thrombolysis in acute ischemic stroke is good for the patient, opening up the blood vessel. We also know that if the blood pressure is elevated when they receive this treatment, it has a bad outcome for the patient. The higher the blood pressure, the worse the prognosis. More likelihood of dying or left disabled, and also more likely that there could be the complication of thrombolysis, which is bleeding. Now, we know if the blood pressure is very high, that's bad, and therefore the general recommendation is to get the blood pressure under control around 180. But it's possible that even more intensive control could even give a better outcome. We don't know that. This target of 180 was designed 20 years ago without any randomized evaluation. So a few years ago, we undertook the ENCHANTED trial to see whether a more intensive target would improve clinical outcome. We randomized over 2,000 patients in multiple countries around the world to compare a less than 140 systolic target versus the guideline recommendation of 180. Now, overall, there was no improvement in the clinical outcome. This is how we measure the recovery of patients on a particular scale called the modified Rankin scale, grading here from 0 to 6. 6 is mortality. The dark here is being very disabled, blue mildly disabled, and then generally 0, 1 is a good outcome with no symptoms. But we did show in the trial that this more intensive treatment reduced bleeding. These are all the various measures of hemorrhage in the brain, mild hemorrhage and more severe hemorrhage, all improved with the treatment. So we have a dilemma as to why would intensive blood pressure lowering reduce bleeding in the brain, which we know is bad, but it didn't improve the overall recovery for the patient. It adds to the controversy. Is there an interaction between blood pressure lowering and the perfusion blood flow into the brain? Would blood pressure lowering have compromised blood flow and caused cerebral ischemia? And so the purpose of our study was to go back through all of the brain scans amongst the participants to measure the cerebral ischemia. This is done in a very detailed manner, to see whether intensive blood pressure lowering may have increased the size of the ischemia in the brain. And obviously we have to use statistical methods to adjust for all the various other variables that may be related to the outcome. So this is how we studied the patients. We had over 2,000 patients with their brain scans available for examination, but we purposely used for our primary analysis those who had a repeat brain scan at 24, 36 hours. Now, some people had MRI scans, most had CT scans, and this was our primary analysis with the CT scans, but we also used secondary analysis around MRI scans on their own, the combination of CT and MRI, and then anyone who had a CT scan at any time during follow-up. So this is the characteristics of the patients in the primary analysis on CT scan. No real surprises here. Most were male in the mid-60s, hypertension on arrival, moderate severity, and a variety of baseline abnormalities on their brain scan. Overall, the difference between the two groups here in terms of their blood pressure control was about 4 to 5 millimeters of mercury. So these are the results, what we call as an unadjusted. So that's the plain variables between the two groups, and then we used different models to adjust for a number of other variables that are important for the outcome. Because the distribution of the measurements of ischemia was very skewed, we have to use a particular technique called median in the analysis. So the important finding is across all of these analyses, there was no statistical difference in the size of ischemia between the two groups. And also when we did all of the various sensitivity analyses according to those just with MRI, a combination of MRI and CT, and any follow-up CT scan, there was no difference between the two groups. So the conclusions from this work, according to this study population, which is very large, and it's a randomized evaluation of intensive blood pressure to a less than 140 target, we did not find any adverse effect of the treatment on cerebral ischemia, the size of infarct, which provides us with reassurance that a more intensive blood pressure lowering within this range does not produce any harm in patients who've received thrombolysis treatment for acute ischemic stroke. Thank you.